That was neat. Nice work. So, my name is Evan Lipson. I'm one of the oncologists down yonder at the Cancer Center. And tonight I'd like to introduce you to some of my patients. First one I'd like you to meet, her name is Annie.
My name is Ann Noel Applegarth. Most people call me Annie. I had soft tissue sarcoma.
So, over the past several years, I've had the privilege to meet a lot of patients just like Annie, who have pretty serious diagnoses like sarcoma. And certainly when you talk to these patients and you get beyond sort of the physical complaints, you hear a lot of what you'd expect, which is fear and anxiety, and my life has question marks on it, and what's the future going to look like? But if you dig a little deeper, it turns out that a lot of these patients have been making unbelievably positive changes in their lives that have given them fulfillment and satisfaction and joy. And so Annie's story is that after her surgeries for her sarcoma, she was asked by a group here in Baltimore who was raising money by swimming for research here at the Cancer Center. And so the group said, Annie, you've got some experience in public events, why don't you help us organize this swim? And so Annie did. And things were going along fine until one day they said, hey, Annie, you know, you should get into the water with us. And Annie thought.
And I thought, oh, Pierre, you're out of your mind. I don't swim. I'm over 50. I'm a fatty 2x4. I don't swim.
Well, so you know where this story is going, right? So Annie decides to take the plunge. She gets into the water and she swims 1 lap, and then she swims 2, and before you know it, she's swimming 10, and she's raising thousands of dollars, and she's training for this 3-mile open water swim. So the day of the race comes, and she gets into the water, and here's what happens.
I came around the bend to the end of the race, and my brother was on the dock, screaming, everybody was screaming, and for the first time I felt, I have thrived. I am thriving, and I have really survived.
So I'm hearing stories like these from my patients, and I'm thinking, God, these are so inspirational. These are like one-person support groups, right? These stories have to be put down someplace. Historically, they have to be saved. So I start writing down longhand what they're telling me. But even when I'm using direct quotes, it's just not capturing the power and the inspiration that I'm getting when I'm hearing the story from the patient themselves in their own words, with their own voice. So I bought a microphone, and here's what happened.
I'm Kevin Stenstrom. I'm a stage 3 melanoma survivor. Running has been a salvation for me to psychologically battle back this disease.
My name is Heather Johnson, and I was diagnosed with metastatic colon cancer. My online persona is that of Heather Johnson, the warrior. It's been very empowering for me to decide that I wasn't just going to accept this diagnosis and lay down for my treatment. I'm going to show my children that, when hardships befall you, you need to stand up, you need to put your dukes up, you need to fight hard. And
My name is Paul Bierlin. I am 50 years old. I have metastatic basal cell carcinoma. After I was diagnosed, there was much more reflection time. There's much more time, especially with my wife, of thinking about our relationship and how blessed we've been and how lucky we've been, and just the wonderful life we've already lived.
So I'm hearing these unbelievable stories, just like the ones that you heard. There are more. This is Dick Copaken. He's an artist and an author and a lawyer, and he uses his art both to express himself and also to give back to his community. This is CJ. She's a woman with metastatic breast cancer. She founded this organization here called MetaViber. It's an organization that does research and outreach for metastatic breast cancer. And she calls this the most rewarding experience of her life. This is Jamie. Jamie's a breast cancer survivor and a volunteer here at the Hopkins Breast Center. She sort of shepherds other people through sort of with the experience of the journey that she's got behind her. She helps out other patients. And so we sort of made a home for this thing. We made a nonprofit organization called Seize the Days, and our mission, as you can see, is to document the ways that people who are living with cancer add life to their days. And So we have a website, seizethedays.org. Check us out. And really, this is a web-based resource for patients and caretakers and healthcare providers, doctors, nurses, social workers. And I think one important element here is that when you get diagnosed, you need to know that you're not alone. You're one person in an army that's fighting this disease. And secondly, we like to combat what I call the Google shock phenomenon, which is when you're diagnosed, the first thing you do is get on Google and you get this big list of all these horrible things that are about to befall you. I think it's important to accentuate some of the positives that come out, even if it's only for a short time, that come out of a cancer diagnosis. Secondly, we're developing tools for educators that I'm hoping to use here at Hopkins, both in the nursing school and in the medical school, so that future nurses and doctors and social workers can virtually meet, quote-unquote, patients before they ever set foot into the clinic. And lastly, we're developing a partnership with the medical library here at Hopkins. And so we're creating an oral history collection of voices of people touched by cancer. So this will be a web-based archive that will be permanently available anywhere in the world as a historical reference and a resource for educators or anyone who'd like it. And so I think when we cure cancer someday, people are going to look back and they're going to hear these stories, and they're going to be in awe of the spirit and the determination and the strength that these folks brought to bear in fighting their disease. Thanks very much.